Good morning, everyone, and welcome to today's Empowering People and Communities webinar. We'll get started shortly. Good morning, everyone, and welcome to our public spotlight of the Southwest Louisiana Area Health Education Center programs, also known as SWLAHEC. And the title is Advancing Tobacco Cessation and Community Health in Louisiana. Louisiana Campaign for Tobacco-Free Living is a program of the Louisiana Cancer Research Center and also the Louisiana Public Health Institute. TFL is dedicated to advancing tobacco control policies across our state. We engage in local and statewide tobacco control policy efforts, focusing on tobacco prevention, reducing the impact of tobacco use in all of its forms, eliminating secondhand smoke exposure, promoting cessation services, and identifying and eliminating cancer and other tobacco-related disparities. We are guided by best practices in tobacco control as outlined by the Centers of Disease Control and Prevention, effective and promising practices of tobacco control programs in effect nationwide, and from the Louisiana Cancer Research Center. TFL's Empowering People and Communities series has the mission to equitably bring health education, resources, and hope to people, populations, and communities in Louisiana by increasing awareness and empowering people, populations, and communities about tobacco and tobacco-related issues. In our work, in order for TFL to have a great impact on tobacco use within the state and tobacco control, we depend largely on community partners across the state, regional partners, local partners. So we have a big grassroots reach within the state in order to accomplish these goals. Today's EPCS will spotlight all of the great work being done by the Southwest Louisiana Area Health Education Center, SWLAHEC, with a focus on their tobacco control and prevention efforts. Before I get started introducing the organization and speaker, I want to remind everyone that any questions or comments that you have, to please add them to the chat, and we'll make sure that we get to as many as possible today. Next slide. I am your moderator, Chriselle Stipe. I'm the Senior Manager of Health Promotions with the Louisiana Campaign for Tobacco-Free Living, which is a program under the Louisiana Public Health Institute. Since 1991, SWLAHEC has served as an independent nonprofit organization and a member of the National Network of Area Health Education Centers, operating in 48 states. SWLAHEC's mission is to improve health status through access to information, education, and health services. Our speaker today is CEO and Board President Ashley Arfey. Ms. Arfey has over 10 years of experience in nonprofit management and operations. She most recently served as the SWLAHEC Chief Operations Officer and managed various departments and grant initiatives. She graduated from LSU with both a Bachelor's of Science and Master's degree in Public Administration. Her 10 years of experience in nonprofit management and operations include having served as operations lead, coaching, and development lead. She also served as a director of operations and interim executive director for Mid-City Redevelopment Alliance located in Baton Rouge, a housing stability and community development agency. She has served in various task force and strategic planning committees that have allowed her to gain a wealth of knowledge and creating sustainable teams and funding opportunities for new and existing community initiatives. Ms. Arfey is a recent graduate of Leadership Iberia 25, where she participated in a year-long development training with groups of her peers. Ashley is no stranger to community engagement and service, as she is currently a member of Downtown Neighborhood Association and a board commissioner for the Hopkins Street Economic Development District in New Iberia. Both groups, focus their efforts on the revitalization and development of community and economic solutions throughout both historic and cultural districts by meeting the people of the community where they are and empowering them to develop, execute, and sustain the solutions they seek. And now, please turn your attention to Ms. Ashley Arfey.
Good morning, everyone, and thank you, Chriselle, for that introduction. So today, I would like to share with you all SWLAHEC programs and services that we focus in our community health with a focus on tobacco prevention and cessation efforts. Some of the learning objectives is to help you all understand how we provide services in communities across Louisiana to improve Louisiana health outcomes, what partners we collaborate with in partnership with locally, statewide, regionally, and tobacco control efforts for our youth prevention and engagement, cessation, and policy support, as well as how do we meet the health needs of local citizens to address the social determinants of health that play a large role in tobacco and nicotine use. A SWLAHEC overview. Chriselle gave you a really good overall overview of Southwest Louisiana Area Health Education Center. Again, we were established in 1991. We are one of 4 AHECs in the state of Louisiana, as well as we are a member of the National Network of Area Health Education Centers that operate in 48 states throughout the country. AHECs are administered by the U.S. Health Resources and Services Administration, HRSA. And as Chriselle shared, our mission is to improve health status through access to information, education, and health services. We do that by focusing our programs on 2 main focus areas. That's recruiting and educating students and health professionals, as well as educating the public on how to live healthier lives. Now, impact is shown through over 30 programs, and yes, I said that right, 30 programs that span statewide through regional, local, federal, state, contractual, and miscellaneous funded programs that improve the health outcomes within our communities. So how do we do the work that we do? We do it through what we call the SWLAHEC theory of change that focuses on community, capacity, coverage, and care. We meet people where they are. We reach people where they are, and we empower them to be a part of the mission as well by allowing them to help us assess and access their communities by mobilizing resources and services to their communities. We educate, recruit, and employ individuals within a rural healthcare workforce. We link individual to coverage, so affordable coverage for all. And then we link community coverage and care to care. So we're connecting individuals to care, but not only that, we are also supporting and sustaining community-led initiatives and coalitions so that we really truly ensure that a community can sustain its health outcomes. So remember those 30 programs I shared with you all? There's a lot of them. And so we categorize them in 7 categories: behavioral and mental health, career and professional education. This is where we house all our AHEC student and healthcare professional pipeline programs. Coalitions and alliances, again, where we help support and sustain community coalitions. Community health programs, these are our grassroots, boots on the ground, community member leaders led programs. Healthcare services, these are our programs that we truly connect and partner with the health systems and clinics where we are either employing individuals within their systems or we are connecting their patients to coverage. Health interventions, again, I'm no stranger to meeting people where they are. These are our programs where we truly meet individuals where they are within their health journey and provide access to intervention care. Health prevention, this is where we provide community screenings. We mobilize many of these community screenings into communities. But we can't do it alone. So with all the different 30 plus programs that we administer, we have a slew of partners, collaborating partners that help us implement the programs and make sure they're a success within the communities, as well as health systems and clinical collaborating partners who assist us with our student pipeline programs, as well as connecting community to coverage to care. So to share with you all some of the programs that we have where we provide tobacco education and resource connectivity. The first programs we have are our youth programs that provide tobacco prevention education. Eat, Move, Grow Education is funded by the Health Enrichment Network in HRSA, where we employ 2 health educators that work in regions 4 and 5 in elementary schools to implement evidence-based wellness school policies and practices to teach students how to lead healthy lifestyle. They visit the schools and teach the schools how to improve children's health environment, where they also ensure that there's a tobacco-free policy implemented within the schools, how to access social emotional learning resources, and educate on healthy lifestyle choices that include tobacco and vape-free lifestyles. That's in our elementary schools. In our youth space, we then pick up with our Empower You Youth Education and Advocacy Program. This program is a Humana Foundation funded program empowering youth in local schools and community organizations across the state to become advocates for overall wellness within their communities. In this program, we develop the knowledge and skills through interactive workshops and peer-led initiatives to promote healthy eating, exercise, hygiene, mental health. In this program, we allow the students, the youth members who are part of this cohort, to actually lead the efforts. So they lead the workshops, they lead the conversations. And within our first cohort, we actually learned that we were missing an important piece. We didn't talk about vaping. We didn't talk about tobacco-free living. And so in our cohort 2, we now have a curriculum dedicated to vaping and tobacco-free lifestyle. In in this portion of it, we will talk about our prevention programs. The Healthy Lifestyle Education to Louisiana Communities is the Louisiana Department of Health WellAhead Louisiana Collaborative Statewide CDC Evidence-Based Lifestyle Change Initiative. This is where we focus on chronic disease prevention and management. In this program, we implement healthy lifestyle resources in local communities by engaging community-based organizations, healthcare facilities, barbershops and beauty salons, faith-based organizations, and nonprofits. And through these different agencies, we provide key services such as blood pressure screenings, heart disease management, diabetes prevention and self-management, obesity prevention, and just recently this year, tobacco cessation, where we are engaging either providers in becoming a tobacco cessation provider and referral for our Connect to Quit line, as well as providing tobacco policy support for any agencies who would like to implement it within their agencies through WellSpot designation, as well as providing tobacco education resources within the community organizations. So this program helps us expand access to care, support healthier lifestyle, and improve health outcomes in a much in an expansive way throughout the community. One of those programs being Curving and Cutting the Numbers project. This project engages community-based organizations such as barbershops, recreation centers, churches, schools, pharmacies, and other high-traffic community sites that are truly within the communities, where we educate on heart health and stroke prevention, connect community members to healthcare resources to manage health conditions. We train these individuals, organizations, barbers, and beauticians on how to host blood pressure screenings within their spaces. We foster meaningful conversations around wellness, building trust, and improving overall health in communities. The beauty about this program is that it's community led. So all the individuals who are leading within these spaces led those screenings, led those community events. And it really provided us a way in which to expand capacity and again, build community trust. Through this program, we also would connect these agencies and organizations to our WellSpot designation program, where they incorporated tobacco-free workplace policies, and they were provided with Louisiana Connect to Quit resources. Our next group of programs are our community-led initiatives. In these programs, the Samaritan Health Initiative, as well as the Love Yourself Women's Wellness Campaign, these are holistic wellness approaches where we help individuals, families, men and women, prioritize their spiritual, mental, and physical well-being. In these programs, we really focused on allowing the community members to lead their efforts, to lead the initiatives. So they would create support groups, counseling. We would provide counseling service, really mobilizing resources and services. What we also did is we ensured that they understood how to live healthier lives with tobacco-free living by providing educational information throughout these programs. To continue to expand our capacity in the messaging of tobacco-free living, we have the Louisiana Community Empowerment Project, where we train our community health workers and advocates in rural communities statewide, where our community health workers provide multifaceted assistance, education. They help address the social determinants of health. They create outreach events. In this program, we utilize our barbershops, churches, community organizations, local community health champions, advocates. We like to call these individuals outreach workers, aunties, community ambassadors. This is where we truly were able to expand capacity and mobilize more information about healthy living and addressing social determinants of health. We also assisted individuals within this space with creating community assessments and assessing their communities, as well as mobilizing resources and services and becoming more educated on how to live healthier lives. One of the great things we were able to do in this program is that we were able to outsource some of our community health workers to the American Cancer Society, where they became advocates of cancer prevention, as well as they were trained on tobacco education and connectivity to tobacco cessation resources. Our healthcare and clinical community health worker statewide initiative is a Blue Cross Blue Shield Foundation grant funded initiative to utilize trained community health workers to improve patient outcomes by bridging clinical care with social support. In this program, we address barriers to chronic disease management by providing self-management coaching for diabetes, hypertension, asthma. We also connect patients to include, we could connect patients to tobacco cessation programs. We assist with healthcare navigation, where they are doing appointment scheduling, social service referrals, medication compliance, health insurance enrollment, as well as provide social determinants of health support resources, where we are assisting individuals, patients with filling out housing vouchers, addressing food security by finding their local food pantry, assisting them with transportation not only to their appointments, but transportation overall to, yes, thank you. Oh, I don't know what I did. Yes. But our community health workers within the healthcare and clinical setting help connect individuals to those, they help address the social determinants of health. And our Navigators for Health in Louisiana, this is where we truly connect coverage to tobacco cessation programs. This is a U.S. Department of Health and Human Services Center for Medicare and Medicaid Services, CMS, federal statewide funded grant program, where we ensure residents and families have access to affordable, comprehensive coverage options and the support needed to navigate the complexities of healthcare enrollment for the health insurance marketplace and LDH Medicaid health insurance. In this program, we offer individualized assistance for determining eligibility. We help consumers apply for Medicaid marketplace insurance. We help individuals retain coverage as well as update their account information, select plans, and we explain their coverage options. With explaining their coverage options, we also ensure that they understand how to utilize their covered services. We connect them to local providers as well as preventable health service such as tobacco cessation programs. So in this program, we truly are ensuring that not only are you connected to coverage, but that your coverage is connected to the preventative or the interventions that you need in your health journey. In this program, our goal is to ensure that 100% of Louisianans are insured with health insurance coverage. And our Do No Harm and Healthy Hands STI HIV counseling, testing, and referral services. This is a cross program. So it falls in Region 4 and Region 5 of the Department of Health, where we work with Imperial Calcasieu, Acadiana Area Human Services, the Department of Health Office of Public Health, STD, HIV, Hepatitis Program, SHIP, partnership, where we provide comprehensive strategies aimed at reducing harm associated with individuals' drug use, overdose, and related deaths. We trained individuals with lived experience to be peers and to serve as advocates and educators within their communities. We empower individuals on their journey toward better health and recovery. We provide support and connection to resources across all phases of recovery. That's connection to rehabilitation, intensive outpatient programs, as well as peer engagement services. We offer essential health services where we offer free HIV, STI, syphilis, and hepatitis C testing, both in Region 4 and Region 5. As well as I want to note that we mobilize this testing. So we are truly meeting individuals where they are, and we have a hotline for both Region 4 and Region 5 where we can be contacted, and we either schedule a testing if that person can wait, or we go and mobilize and meet them where they are. We provide counseling and referral services, as well as we distribute prevention kits materials. These prevention materials can include Narcan, fentanyl strips to test what they're using, as well as cleaning kits to ensure that as they're using that they're using clean. What we also recently did within our last year, we were fortunate enough to be provided free. We were fortunate enough to have access to free over-the-counter meds. And so we created a community care closet where we provide nicotine gum for distribution as well. Within this role as well, because we're able to meet a lot of people where they are, we provide a community resource guide that also includes the Louisiana Connect to Quit Tobacco Cessation resource line. In our maternal and infant health programs, we have the Nurse Family Partnership. This is an LDH Bureau of Family Health partnership to provide specially trained nurse visits for first-time moms to successfully improve pregnancy, child health, and development outcomes. This starts in the early pregnancy and continues until the child is 2 years old. We educate moms on baby care, feeding, bathing, safe sleep practices, effective parenting techniques, and understanding child development, as well as strategies to support a nurturing home environment, which of course includes having a tobacco-free home. We provide regular health checks for both the mother and the child to monitor development and promptly address any health issues. We provide access to community resources, healthcare services, childcare, and educational opportunities to support family well-being, which includes tobacco-free program resources as well. And the goal setting to support achieving personal goals related to education, employment, and family planning to enhance economic self-sufficiency. So we understand the importance of connecting and addressing the social determinants of health for the family, the mother as well. So those were a list of programs that SWLAHEC already had where we integrated tobacco prevention, control, and awareness resources. However, we do have a program that's been spanning from 2020 to now 2025, and it is the Healthy St. Landry Initiative. This is a tobacco control initiative in partnership with the Department of Health, Louisiana Department of Health, SWLAHEC Louisiana Collaborative Initiative aimed to reduce tobacco use and promote a tobacco-free Louisiana in St. Landry Parish for a long-term health improvement. We work closely with the schools, community organizations, and healthcare providers in St. Landry Parish to educate about risks of tobacco use and provide policy support. The key components of this grant, this CDC grant, is the adoption of workplace tobacco-free policies that's through municipalities as well as government municipalities, as well as agencies, organizations, and businesses. Promote the promotion of Louisiana Tobacco Quit Line, hosting health education events, either with us hosting them or us being a part of the events already happening within the communities, and conducting healthcare provider training sessions to those providers within St. Landry. In 2018, the Healthy St. Landry Coalition was established, and we understood the importance of already partnering with a coalition that was already in existence, already doing the work to address the health needs of the community. So in 2020, in our year one, we went ahead and established a partnership with the Healthy St. Landry Coalition and created the Tobacco Cessation Steering Committee. Our target populations with this grant is youth and young adults, those suffering with behavioral health, those in the low socioeconomic status, pregnant women, and African Americans. Within our first 5 years of the grant, we have been able to engage 7 providers to be to be trained on our tobacco cessation program, as well as be part of the referral process. We've printed and disseminated Connect to Quit Louisiana Quit Line materials. We've developed a community resource guide, held multiple community leader education sessions, such as a mayor's meeting and a community leaders summit. And we've trained individuals on the Medicaid plans on cessation services. In the first 5 years of the grant, SWLAHEC was the fiscal agent and we sat on the board. We were provided a supplemental sixth year by the CDC, and so we have some future plans ahead of us. Some of those plans include engaging with more local coalitions and community stakeholders and leaders within St. Landry to be a part of not only Healthy St. Landry, but also the Tobacco Steering Committee. We want to strengthen the Louisiana Smoke-Free Air Act to this day, St. Landry does not have any ordinance changes. And so we hope to make that change within this last year and promote awareness and use of evidence-based cessation treatment with engaging in more community events, as well as engaging more providers to be part of the referral process. To create sustainability, we intend to implore the help of community health workers and community-based organizations, as well as activate champions who have already been part of our providers, who have already have become WellSpot designation organizations, to share their stories of success with the others and hopefully recruit and engage others to be a part of the tobacco-free living program. We've engaged Next Era to be part of our youth space and engaging in connecting with the local schools within St. Landry Parish. At SWLAHEC also, we commit to engage and connect them with schools in Region 4s and Region 5 that we already partner with through our pipeline programs. So we truly understand the need of youth education and advocacy and development. And because we already have Empower You, the hope is to also connect Next Era with our Empower You program and participants as well. We also understand the importance of creating sustainability. And so with the help of Healthy St. Landry, we understand the need to not only update our resource guide that we created a few years back, but also ensure that it continuously updates, because as we know, change happens every single day. And so to be able to ensure that that resource guide stays up to date, we hope to engage more individuals, community ambassadors that are just as passionate, educate them on tobacco cessation, tobacco prevention and awareness, and get them involved in ensuring that the resource guide stays up to date, as well as distributed throughout their communities. These are some of the things we hope to do. A few others that are not listed here is that currently, our Connect to Quit line is not electronic. We hope within this year 6 that we can engage partners to help us create a more electronic process. Right now, our providers are having to fax that information in, and that could be a bit time consuming. So we do want to try to streamline our processes so that we can have more referrals come through. We want to increase those providers from 7 in St. Landry to more. And of course, we want more WellSpot designations. We've been able to have a successful amount of individuals that become WellSpot designated, but we need those individuals who are still kind of against it, that maybe are keeping those ordinances from coming through, such as the bars, the lounges, the clubs, and different spaces like that, to really get on board and identify the health prevention that can happen with adapting a tobacco-free living. And that's the end of our presentation. Thank you all for joining and listening in. And if you have any questions, feel free.
Thank you, Ashley, for that. Next slide. For the valuable information that you've provided to us. A lot of information for those attending on the webinar, information that they could use within their community, especially servicing residents and servicing patients. We really appreciate that information. We've had Next Era teams in the SWLAHEC service area in the past. And we're excited at SWLAHEC's interest in reestablishing a presence in Next Era. So with that, I'll just let you all know a little bit about Next Era as we're discussing services within Southwest Louisiana. Since 2017, Next Era unites teens across Louisiana as agents of change, advocating for tobacco-free lifestyles and promoting healthier communities. Youth are trained on state and local policy campaigns, public speaking, community organizing, and more. Next Era Youth plan, they lead their own campaign projects and events. Next slide. We have many successes within Next Era. We've passed 30 plus local ordinances to create smoke-free bars, gaming venues within Louisiana. And so these are local ordinances which are different from actual state laws. So local ordinances that actually improve smoke-free policies within those municipalities. And youth had played a big part in that as far as educating officials within their communities and educating adults and youth within their areas also. There were presentations at town halls and city council meetings. Education is being done at the school board with the school board members at school board meetings. They've had the opportunity to present at national conferences. A few years ago, we had some youth actually present a session at the National Tobacco and Health Conference. Also, media coverage about the work that they're doing. So these are successes within Next Era. And a benefit actually for the youth of being involved in Next Era and being a Next Era youth advocate is that they have the opportunity to work on campaign activities that make changes that will last a lifetime, changes within policies within the state. Another benefit for them is they develop leadership and activism skills. So that leadership and gaining the experience of being a part of a public programming and also develop leadership in speaking engagements, and just advocating for wellness and health within their communities. Another benefit is they attend conferences and meetings to present their work. They earn awards and community service hours. And just being involved in creating a real change within their schools, their communities, and their state. So under Next Era, we have our Next Era advocacy groups, which are usually in schools, or it could be a youth community program where our youth members come from. Also, on the Next Era, we have a youth advisory board where they apply to become an advisory board member. And we have representatives across the state in all of the 9 public health regions, where we have youth representing each of their areas, and we bring them to the table because we want their input in the work that we're doing regarding reaching youth and the vaping epidemic and tobacco use epidemic among the youth. So just a little bit more information about Next Era. Next slide. So we're at the question and answer session. If you have any questions, please place them in the chat, or well, please place them in the Q&A if there are any questions. I'll allow a few seconds for that. While we're waiting, Ashley, I actually have a question. How can others within the communities that work in communities partner with SWLAHEC?
We have a few different ways of how organization can partner with us. Our community health, our department closely works, as you can see, closely works with a lot of community organizations, and even more so like barbershops, beauty salons, nail salons, and things like that. So many of times you can either connect with us through a community health worker that we've already employed throughout your community, or a community ambassador. You can also visit us during our community events. We try to be a part of either your community events that's already happening within your communities, or we like to put on events. We love a good party, as we call it, health parties, right? And so
Right.
we love to be able to connect with individuals. Even then, a lot of times individuals connect with us and become part of our mission, as well as through our Navigators for Health in Louisiana. Many of the organizations that are part of, they also, like the churches, faith-based organizations, are big on understanding the need of their congregation. And so many of times we can also assist with helping you learn what it looks like to help your congregation be ensure coverage. So those are some of the ways, but then also, like I shared, through some of our health intervention programs, it could be through our hotlines, contacting us through our hotline so that we can ensure that we get someone, we meet the needs of the people, as well as our contact information. So you can call our 1-800 number for our Navigators for Health Louisiana, or our 337 number that goes to our Lafayette as well as Lake Charles office. But I also say this, I have a staff, a team that's very out there in the community. So most of the time they know their people. And so they're connecting with them personally as well.
Thank you.
Thank you.
Thank you. I think we may have, um, okay. Someone's saying that, I don't know, Haley, if we could check that. Someone said that their chat messaging is disabled. So maybe we could work on fixing that.
Hi, is it Fayetta from Alabama? Great to have someone outside the state. Hello. Feel free to connect. We have counterparts. We have AHECs in Alabama as well that we connect with frequently. So feel free to connect.
Okay. So someone's asking for the hotline number.
Yes, I will put it in the chat.
Okay. We have a few minutes for more questions. Okay, from Fiamula Bradley, is there a comprehensive roster available that can be shared with the TFL regional managers so more collaborative opportunities can be fostered?
Is that from us? From SWLAHEC?
Yes, from
Oh,
SWLAHEC. So,
yes.
yes.
Apologies. So yes, we do have a program guide. We have a program guide that lists all 30 plus of our programs. So what we can do is send it out to you, Chriselle, and the team, and y'all can feel free to share it with everyone as well. We're also going to be debuting it at the end of this month. It's been a 2-year process, you all, because as you can imagine, we love to create programs. We like to fill the gap, right? And so at some point in time, I had to tell my team, let's stop because we need to print it. But we are finally going to have it, so we'll feel free to share it with you all prematurely, as well as debut it electronically through our website, as well as social media, July 30th.
Great. We'll look forward to seeing that. Thanks, Ashley. Let's see. Oh, is LPHI working in St. Landry as well? Um, Tobacco-Free Living has a regional manager,
Mhm.
and that covers Opelousas St. Landry Parish, and her name is Mitzi LaSalle. So TFL has representatives across the state within specific regions.
Yes, and Mitzi is part of our actually part of our tobacco steering committee. So she's been a part of the efforts and the work that we've been doing in St. Landry Parish.
Great. See. Okay, when someone connects with the quit line and is ready to quit, what can they expect? Yes, Mitzi. When they connect to the quit line, if it's a provider that actually directly refers them to the quit line will contact that person or that patient and set up enrollment and begin counseling with them. For those who call the quit line, they will be asked initial assessment questions just regarding their tobacco history and their nicotine dependence and tobacco usage. So we'll get a lot of information from them and then set them up in a standard program, depending on that person. If that person has identified that they have a behavioral health issue, the counselors will forward them to the behavioral health track. If it's a pregnant tobacco user, um, that person will go into the pregnancy track. But we also have a standard track where people can enroll and get service. Also, it's coaching, but it's also in addition to that, depending on their age, they can get 2 weeks of the nicotine patch or the nicotine gum as a sample to get them started. And Mitzi has put into the Q&A that those in Lafayette can contact her as well. SWLAHEC program guide. So yeah, you just mentioned that, Ashley, about the program guide. So people are looking to see that and requesting it.
I'll make sure to send it.
Okay, so there's a link in here.
Oh, okay, then my team. Well, thank you, Taffy. Taffy is my colleague.
Your team's on there. Yeah. Okay, great. Thank you. So everyone, the link to the SWLAHEC program guide is in the question and answer. Right. Well, thank you everyone so much
Yes.
for participating today. And we would like to thank everyone on the call and thank you, Miss Ashley or Faye, for enlightening us and letting us know about SWLAHEC and the services you provide in Southwest Louisiana. Um, and I'm sure that we have others on the call that are outside of your service area who is looking at the work that you're doing and may even service some people within your area that can refer those to your services. Thank you for sharing how you all can navigate folks depending on what their health issue is and what their need is and what social determinant of they can come to you all for services. And thank you for highlighting the work that you're doing in tobacco control and promotion of tobacco services and cancer prevention. And so that's why we wanted to let everyone know what you all are doing. Um, for everyone else, we will be emailing this recording and resources, and also a quick survey will be sent to you. So please fill that out for us. This recording will live on YouTube, and it will also be accessed from our website, tobaccofreeliving.org/empower.
Yeah.
If you happen to receive an end of year survey from us, please consider providing feedback for our EPCS webinar. This helps us to make the content better for you. So please, if you happen to receive an email from us regarding it, please consider filling it out. Mark your calendars for the next EPCS, which is August 14th at 11 a.m., and more information is to follow regarding that. I also want to thank Haley Osiago, who is on with us, and she's been helping control the Zoom today. You see her. But thank you, Haley, for the social media content and the behind the scenes tech that you are doing for us today. Thank you, Haley. Everyone, have a good afternoon and take care.
Thank you all.